This is webinar 2 in the Minnesota Drug Diversion Prevention Pathway webinar series, looking at 5 actions that leaders can take to decrease drug diversion risk in their long-term care facility. The first and most important thing leaders need to do to decrease the risk of drug diversion is to make sure that they have developed a good understanding and awareness of the issue. Drug diversion sits at the crossroads of several issues in long-term care, with a lot of moving parts, most notably substance use disorders, addiction, and issues of pain control in long-term care residents. It is complicated, hidden, and can cause chaos and harm, taking us by surprise if we aren't vigilant. 1 in 10 Americans have a substance use disorder. This statistic includes both drugs and alcohol. This is thought to be even higher among healthcare workers. It is generally believed that this is due to several causes: stress, knowledge of drugs, a tendency to self-medicate, access to controlled substances, especially opioids, and a belief that their additional understanding will help them to control their use. The American Nurses Association estimates that at any given time, 6 to 8% of nurses are practicing while impaired. And while this includes both alcohol and drug use, over the last 2 decades, Minnesota's statistics show an alarming rise in the misuse of opioids. The opioid epidemic continues to demonstrate that addiction has few demographic boundaries. While addiction can be the result of reckless recreational use, it can also develop in other ways. It can affect people who don't fit the stereotype of someone whose risky behavior might lead them to abuse. People who have no intention of using opioids irresponsibly can become dependent during exposure from episodes of acute injury or after medical procedures. They are prescribed opioids during a surgery or as part of the response to an injury. The issue comes when they cannot wean themselves from the opioid medications, either because of continued pain or because of addiction. At some point, a prescriber will refuse to continue prescribing the medication. So, driven by pain or addiction, the person looks to obtain opioids in another way. When that person is a healthcare provider, access to opioids at work can be a huge temptation. The fear of withdrawal symptoms or pain can lead to desperate, out-of-character behavior. Addiction can last far longer than the visible injury or illness. A person may experience chronic pain or may be completely recovered but still addicted to opioids. What that looks like across long-term care in Minnesota is concerning. This chart shows the number of substantiated drug diversion investigations in assisted living environments over the most recent 3 years where we have data. This is what it looks like in nursing homes across the state. There are around 370 nursing homes in Minnesota. If the most recent year was dispersed evenly, more than 10% of nursing homes would have had a substantiated incident. When we look at this cumulatively, this is almost a 10-fold increase across the most recent 3 years where we have data. While most clinicians will never divert controlled substances, we know it's happening, and it's concerning. Often drug diversion prevention is not a priority if an organization has never had an incident. But literature and experience demonstrate over and over that regular people can become addicted to controlled substances, and addiction can lead to reckless behavior. If you look for diversion, there is a high likelihood that you will find it. The second action a leader can take to decrease the risk of drug diversion is to educate your entire staff. When every employee knows about diversion, it decreases the opportunities in your home for diversion to go unobserved. Minnesota's Drug Diversion Prevention Pathway for Long-Term Care recommends that all employees participate in drug diversion education, as it increases facility-wide awareness and the likelihood that employees will report unusual activities they may observe. The education should include the definition of diversion, how diversion harms residents, facility-specific vulnerabilities, universal responsibility to observe and keep the residents safe, how to report suspected diversion, the investigation process, and what to do if a person needs help with controlled substance addiction. The third webinar in this series is a plug-and-play education module for employees. We have also included the PowerPoint for that presentation so facilities can tailor it to their specific context and needs. The third action a leader can take to decrease the risk of drug diversion is to complete a walkthrough assessment of your facility. A systematic assessment of processes and careful observation of the physical plant can help leaders to identify vulnerabilities and prioritize actions. It is an easy and efficient way to look at embedded systems and structure. The assessment entails one or more leaders and staff physically walking through the facility to identify areas of vulnerability with medication security. The Drug Diversion Prevention Pathway Project has a toolkit with resources for the physical plant assessment. The fifth webinar in this series is an overview of the recommended physical plant assessment, and there is a checklist for participants that is linked under the Leadership Guidance and Education section of the toolkit. The fourth action a leader can take to decrease the risks of drug diversion in a long-term care facility is to ask staff about those risks. Proactive staff safety interviews to ask specific questions about controlled substances can be a great way to learn about facility vulnerabilities. Clinicians have the best perspective to identify drug diversion risks within the facility. They are dispersed in all areas of your building, are well-versed in the complexity of your residents, and know what is working and what isn't. Proactive interviews can identify broken processes or vulnerability in your home prior to an occurrence. The goal of the safety interview is to analyze the current controlled substance process, looking for opportunities to make things safer or more intuitive. The toolkit has a resource on successfully performing these interviews. Each leader will have a different approach to this interview, but it is intended to be an information gathering event, not an interrogation. These interviews are much more effective if you do not coach employees during the interview and address any education needs related to policy, process, or resources at another time. These discussions can also be encouraging for your staff to see that you value their expertise and opinion, and that you are willing to adjust process or policy based on their recommendations. And the fifth action a leader can take to decrease the risk of drug diversion in a long-term care facility is to approach this issue methodically. A systematic approach where a facility commits to improving process over time creates a safer environment for residents and staff. The Drug Diversion Prevention Pathway was designed to give leaders a structured way to assess facility process, identify medication and facility vulnerabilities, prioritize interventions, tailor tools in the toolkit, decrease vulnerability to drug diversion, and by doing so, improve patient safety. The pathway and toolkit are located at www.apiaryconsulting.com under the Project Links tab. Webinar 1, Pathway Overview, can give you an understanding of how the pathway is set up and the tools that are available to assess your facility and respond to suspected drug diversion.